Imagine being an older Australian with multiple health conditions. You visit your GP in the morning, see a specialist in the afternoon, and arrange home support services through a completely different system. Now, imagine having to repeat your medical history every single time. In a country with world-class healthcare, why are so many people still falling through the cracks? Today, we're exploring why integrated care could be one of the most important healthcare reforms Australia has ever undertaken, and what's standing in the way. Hi, I'm Elsa. With over 25 years of experience as an aged care consultant in Australia, I'll be sharing practical advice to help you navigate these changes. Let's get started. For decades, Australia's healthcare system has operated in separate sections. Primary care, hospitals, aged care, and disability services often work independently from one another. While each service may perform well on its own, patients are frequently left to coordinate everything themselves. This becomes especially difficult for older Australians and people living with chronic illnesses. Instead of receiving one connected healthcare experience, many people are forced to navigate multiple systems, appointments, and providers. As Australia's population ages and chronic disease becomes more common, this fragmented approach is becoming increasingly difficult to sustain. The first step toward integration is shifting from a provider-focused system to a person-focused system. Instead of expecting patients to coordinate their own care, healthcare professionals need to work together around a shared care plan. Australia has already made progress through initiatives like My Health Record. But technology alone is not enough. True integration happens when GPS, allied health professionals, specialists, and community support workers collaborate and share information effectively. The goal is simple. Patients shouldn't have to tell the same story 4 different times to 4 different providers. The second key insight is that successful integration is often local. Australia's primary health networks, or PHNs, play a critical role in connecting services within communities. Rather than relying on a one-size-fits-all national solution, PHNs can build partnerships that reflect local needs. Some regions have created health hubs that bring together GPS, hospital specialists, mental health professionals, and care coordinators. These local partnerships help patients move more smoothly between services and reduce the risk of people being lost in the system. Perhaps the biggest challenge facing integrated care is funding. Australia's healthcare system is funded by different levels of government. The Commonwealth funds Medicare, pharmaceuticals, and aged care. State governments fund public hospitals. This split can create unintended incentives. For example, hospitals may be under pressure to discharge patients quickly, while community services may not have enough resources to support recovery at home. As a result, some patients end up returning to hospital shortly after discharge. Healthcare experts increasingly believe that future reforms should reward providers for keeping people healthy, rather than simply providing more services. When healthcare providers are rewarded for long-term outcomes and prevention, integrated care becomes much easier to achieve. The future of healthcare in Australia isn't just about building more services. It's about connecting the services we already have. Integrated care requires better communication, stronger partnerships, smarter funding, and a genuine focus on the person at the centre of every healthcare journey. Ultimately, success won't be measured by how many services we provide. It will be measured by how seamlessly those services work together for the Australians who rely on them. If you found this video helpful, give it a like and share it with others. Subscribe to our channel for more insights into aged care in Australia.